Vaginal infections are common. Many women experience them at some point in their lives. They can be uncomfortable and annoying. Sometimes these infections can keep coming back. This can be frustrating and concerning. Recurrent vaginal infections happen when an infection clears up but returns soon after. This means you get the same infection multiple times. It's important to remember that you're not alone in this. There are many reasons why these infections recur. Understanding these reasons is the first step to preventing them. Once you know what causes them, you can make changes to stay healthy. Hormones play a big role in vaginal health. They are chemical messengers that travel through your bloodstream to tissues and organs, affecting many different processes over time. When it comes to vaginal health, hormones are crucial in maintaining the delicate balance of bacteria and yeast that reside in the vagina. This balance is essential for preventing infections and ensuring overall vaginal health. They affect the balance of bacteria and yeast in the vagina. A healthy vagina has a mix of good and bad bacteria, but the good bacteria usually keep the bad bacteria in check. Hormones like estrogen help maintain this balance by promoting the growth of good bacteria. However, when hormone levels fluctuate, this balance can be disrupted, leading to an overgrowth of bad bacteria or yeast. Changes in hormone levels can disrupt this balance. For instance, during your menstrual cycle, hormone levels rise and fall, which can affect the vaginal environment. Similarly, hormonal contraceptives can also influence this balance. When the balance is disrupted, it can lead to symptoms like itching, burning, and unusual discharge, which are signs of an infection. This can make you more likely to get infections. Vaginal infections, such as bacterial vaginosis and yeast infections, are common when the balance of bacteria and yeast is disturbed. These infections can cause significant discomfort and may require medical treatment to resolve. Hormonal changes happen throughout a woman's life. From puberty to menopause, a woman's body undergoes several hormonal shifts. Each stage of life brings its own set of hormonal changes that can impact vaginal health. Understanding these changes can help you take proactive steps to maintain your vaginal health. Puberty, menstruation, pregnancy, and menopause all cause hormonal shifts. During puberty, the body starts producing more estrogen, which helps develop the reproductive system. Menstruation brings monthly hormonal fluctuations. Pregnancy causes a surge in hormones to support the developing baby. Menopause leads to a decline in estrogen levels, which can affect vaginal health. These shifts can make the vagina more prone to infections. For example, during pregnancy, the increased levels of estrogen and progesterone can make the vaginal environment more susceptible to yeast infections. Similarly, the hormonal changes during menopause can lead to vaginal dryness and thinning of the vaginal walls, increasing the risk of infections. For example, low estrogen levels during menopause can thin the vaginal walls. This thinning makes the vaginal tissue more fragile and less able to maintain a healthy balance of bacteria and yeast. As a result, postmenopausal women may experience more frequent vaginal infections and discomfort. This makes it easier for bacteria to cause infection. When the vaginal walls are thin and dry, they are more susceptible to small tears and abrasions, which can become entry points for harmful bacteria. Maintaining vaginal health during menopause often requires special attention and care. Understanding how hormones affect your body can empower you to take control of your vaginal health. By being aware of the hormonal changes that occur throughout your life, you can take steps to maintain a healthy balance of bacteria and yeast in your vagina. This includes regular checkups with your healthcare provider, maintaining good hygiene, and seeking medical advice when you notice any changes or symptoms. Taking proactive steps can help you maintain optimal vaginal health and overall well-being. What you eat can affect your vaginal health. A diet high in sugar can increase the risk of yeast infections. Sugar feeds the yeast that naturally live in the vagina. Too much sugar can cause the yeast to overgrow, leading to an infection. Try to limit sugary drinks, processed foods, and sweets. Focus on eating a balanced diet with plenty of fruits, vegetables, and whole grains. These foods nourish your body and support a healthy vaginal environment. Remember, a healthy diet is beneficial for your overall well-being, not just your vaginal health. Section 4. Dress for success. Choosing the right underwear and clothing. In this section, we will explore how the right choices in underwear and clothing can significantly impact your vaginal health and overall comfort. What you wear can impact your vaginal health too. It's not just about style or fashion, it's about making choices that promote a healthy environment for your body. Tight-fitting clothing, especially underwear, can trap moisture and heat. This is particularly true for materials that don't breathe well, like certain synthetics. This creates an ideal environment for bacteria and yeast to thrive. When moisture and heat are trapped, it can lead to infections and discomfort. Choose breathable underwear made of cotton. Cotton is a natural fiber that allows air to circulate, reducing the risk of moisture buildup. Cotton allows air to circulate, keeping the vaginal area dry. This helps in maintaining a balanced environment, which is crucial for preventing infections. Avoid synthetic fabrics like nylon and spandex for underwear. These materials can trap heat and moisture, creating a breeding ground for bacteria and yeast. When it comes to clothing, opt for loose-fitting styles that allow your skin to breathe. Loose clothing helps in reducing friction and irritation, which can be beneficial for sensitive skin. Avoid wearing tight pants or leggings for long periods. Tight clothing can restrict airflow and increase sweating, which can lead to discomfort and potential infections. Wearing breathable clothing can help prevent the growth of infection-causing microorganisms. By making thoughtful choices in your wardrobe, you can enhance your comfort and support your vaginal health. Remember, it's not just about looking good, it's about feeling good and staying healthy. Section 5. Hygiene habits for a happy vagina. Good hygiene is crucial for maintaining a healthy vagina. It's not just about feeling fresh, it's about preventing infections and ensuring overall well-being. Simple daily habits can make a big difference. However, it's important to be gentle and avoid harsh products. Many commercial products contain chemicals that can irritate the sensitive skin of the vulva and disrupt the natural balance of bacteria. The vagina is a self-cleaning organ. It has its own natural mechanisms to keep itself clean and maintain a healthy environment. This means you don't need to use strong soaps or cleansers. It naturally maintains a healthy pH balance. The acidic environment helps to prevent the growth of harmful bacteria and yeast. Disrupting this balance can lead to infections and discomfort. Washing your vulva with mild, unscented soap and water is enough to keep it clean. Avoid using scented products as they can cause irritation. Remember, the goal is to clean the vulva, not the inside of the vagina. Avoid douching, as it can disrupt the natural balance of bacteria in the vagina. Douching can push harmful bacteria further into the reproductive tract, increasing the risk of infections. Also, avoid using feminine hygiene products like sprays and wipes. These products often contain fragrances and chemicals that can cause irritation and allergic reactions. After showering or swimming, pat your vaginal area dry. This helps to prevent moisture from lingering, which can create an environment where yeast and bacteria thrive. Moisture can encourage the growth of yeast and bacteria. By keeping the area dry, you reduce the risk of infections and maintain a healthy vaginal environment. Simple habits like these can go a long way in ensuring vaginal health and comfort. Section 6. When to see your doctor. Recognizing warning signs. While prevention is key, it's important to know when to see your doctor. If you experience unusual vaginal discharge, itching, burning, or pain, don't ignore it. These symptoms could indicate an infection that needs medical attention. Your doctor can diagnose the cause of your symptoms and recommend the appropriate treatment. It's also important to seek medical advice if you have recurrent infections. Your doctor can help you identify the underlying causes and develop a personalized prevention plan. Section 7. Taking charge, prevention, and treatment options. Remember, you are not alone in this journey. Millions of women experience recurrent vaginal infections. The good news is that prevention and treatment options are available. By understanding the causes and adopting healthy habits, you can significantly reduce your risk of infections. If you do experience recurrent infections, don't hesitate to seek professional help. Your doctor can provide guidance and support to help you find relief and reclaim your vaginal health. Taking charge of your vaginal health is an act of self-care.